I'm a second year PhD student in the Department of Sociology here at Durham University. I'm also co-supervised in the sport department because my primary area of interest is physical activity. How can we get the population of the UK more interested in physical activity, exercise and sport for the benefit of their health? My PhD looks at policy in particular and the way in which government can influence physical activity. So I've spent the last year or so speaking to policymakers in government, Lords, MPs and civil servants as well about the challenges and complexities of doing just that. The main project that I worked on at Public Health England was a big systematic review of reviews of digital health interventions. Digital health interventions are things like social media, the internet and apps. How could we use these to increase people's physical activity, reduce the amount that they smoke and drink, and also look at their diet? How could they lose weight using these interventions? So we collected all of this stuff together and presented our findings based on how effective these are for those outcomes. We did this with the health checks team. So this was a different team within Public Health England who oversee GP practices health checks, which are free for 39 to 74-year-olds to go and have an MOT on the health, essentially. So how could we use these apps to help promote the behaviours that they were interested in to reduce cardiovascular disease? On a day-to-day basis, the placement was very similar to any other office job. We'd work from 8 till 5, 9 to 5, depending on the day. We'd come in, we'd have team meetings. But I think where it was different is we'd go off and do our own individual projects a little bit more often and work on our own based on our interests and our relative expertise. So we may only come together once a week, in some cases once every 2 weeks, to discuss projects, how they're going, and share it with the team. There were 3 key things I think that I did day to day. The first of which was around evidence use in those policy processes. So it might be something like the big evidence review I've spoken about, or more rapid reviews for different parts of government, or even different teams within Public Health England. An example would be when the Environment Agency came to us and asked, how can we use behavioural science to reduce the amount of coal and wood that people are burning in their homes? The second key thing is evaluation. We run a whole range of behavioural science interventions and we were evaluating how effective are they. Sometimes that was experimental, sometimes it was using qualitative research to find out about that. That might range from anything to do with antimicrobial resistance or reducing the amount of antibiotic use, or something as simple as trying to reduce the amount of sugary snacks that we're putting in children's lunch boxes. The third thing for me, I think, which was different to a number of the other members of the team, is very early on I was trained by Public Health England in data protection, data management and data anonymisation, and I became sort of the team's advisor on really ensuring that we met the rigorous standards of data management for use of data with third parties. So we'd give things to universities for further evaluation, or even just sharing our data with another team in Public Health England. The benefit of working with industry, in particular working with policymakers, is that before I came to university, I had a large amount of practice-based experience of public health. Here, I'd had a large research-based experience, and I really wanted to complete that research, practice, policy triad and gain that first-hand policy experience. So for me, I've been able to really appreciate day to day what policy making is about, how is evidence used within policy, and I've been able to bring that back to my research and really think about practical ways that I could make recommendations and implications for policymakers. I think we get very caught up in university in our theoretical perspectives, which are often very different to the real world of policy making and policy implementation. And I think being able to appreciate that has actually shaped the way I've started to write my work as I go along. So that's the main thing. My greatest achievement on placement would have to be the systematic review of reviews, simply because of its scale. It had 97 systematic reviews, which obviously contained many papers themselves. That's a project that, if I was to do it as part of my PhD, might take a year, 2 years. It might even be a PhD in itself, given the timescale we were working on. To produce a rigorous review of that standard within 3 months, I think was an outstanding achievement for everybody involved. But then you have to consider the placement as a whole. We're parachuted into a government department, we've never been there before, had to move to London, and we had to hit the ground running. So just completing a placement was a big achievement in itself. My advice to students would be to find out as much as you can about the placement in advance. This sounds really simple, but we need to think about the added value, both in terms of what skills and experiences we as students bring to the hosts, and what opportunities and experiences can they give to you as the student.